Sometimes you do these things so regularly and everything is systematically set up, and you have to just hit the record button before you start. And I talked for 15 minutes without hitting the record button, and now I have to redo this, but it's okay. So this is a nice report on the state of climate services for health. As reported for 2023 by the World Meteorological Organization and the Global Framework for Climate Services, along with many partners like the Belmont Forum and NOAA and so on. It's a nice report and it's very detailed with lots of case studies. I'm not going to read any of them, so I'll cover some key messages as well as the challenge and what the value of health services are, what kind of investments are needed, what barriers are being faced, and what the ways forward are. So it's very brief. It's a nice report. You can follow up if you're interested in detail, especially the case studies are very valuable, so I won't be covering any of that here. What are the key messages of the report? What are the findings in terms of state of climate services for health as of 2023? The world is warming at a faster rate than at any point in recorded history. Climate change undermines health determinants and increases pressures on health systems, thereby threatening to reverse decades of progress to promote human health and well-being, particularly in the most vulnerable communities, especially continent of Africa. Africa hasn't contributed much to climate change in terms of emissions and accumulation of CO2, but they are facing some of the worst impacts and they are quite vulnerable. So if you go back to, let's say, the Second World War or even before the then Green Revolution, after that the health systems have gotten better, human lifespan has grown steadily, starvation has been reduced in most places, but then climate change came along and air pollution especially, which is related to our industrial activities and consumption of fossil fuels and so on, has become a major killer now as well. So health protection is a priority in almost all countries and requires high quality information to better inform decision making. So most countries have submitted nationally determined contributions under the Paris Agreement, and they have revised the plans because they were not sufficient in terms of reducing emissions to meet global warming targets such as 2 degrees C warming by 2100 with a 67% probability, or stay below 2 degrees C, and national adaptation plans which kind of put down the policies, strategies, investments, financing, etc. for adaptation to climate change impacts that are already happening. Climate information and services are fundamental for better understanding how and when health systems and population health can be impacted by climate extremes and a changing climate, and for managing climate related risks. Risk, as I have discussed in many places and IPCC does as well, is a multiplication of hazards, which are the climate impacts, vulnerabilities which depend on income, gender, age, housing, etc., and exposure which depends on infrastructure, access to hospitalities, and so on and so forth. And now also responses. Many countries have done well in terms of responding to climate impacts, especially on health and so on, heat waves, floods, droughts, etc. So these have to be supported by climate information and services at scale. Heat waves affect people differently in different neighborhoods of the same city, so early warnings have to be at that scale, and we are not there yet. Okay, there's a huge potential for enhancing the benefits of climate science and climate services for health. Despite examples of success, data shows that health sector is underutilizing available climate knowledge and tools. At the same time, climate services need to be further enhanced to fully satisfy the health sector requirements in terms of the scales at which the health sector needs the information And it's not always easy that you produce some information and expect it to be used in decision making. You have to understand why it's not being used. So co-producing these tools so that you don't just produce some early warning and put it on the web and say use it, but you understand what they need in terms of early warnings. Okay, so those matter a lot. We are learning, of course, extreme heat causes the greatest mortality of all extreme weather, yet heat warning services are provided to health decision makers in only half of the affected countries. Many countries haven't invested in weather and climate forecasts, but some countries like India help the neighboring countries with their investments. Extreme heat services are expected to rapidly increase by 2027 under the United Nations Early Warnings for All initiative, which is great news, and many countries are participating in it. Every year, poor air quality is responsible for millions of premature deaths and is the fourth biggest killer by health risk factor. Concerns relating to air quality, climate change, and health are interlinked, of course, because our use of fossil fuels for everything, especially for producing energy, is a big factor in air quality, as well as vehicles, industrial activities, deforestation, etc., urbanization. Of course, we have to interlink all these when we produce information for the health sector, because the health outcome depends on these linkages. There is insufficient investment to improve the capabilities of the health sector and related climate services to deploy research and integrated systems for effective climate adaptation and mitigation related decision making. This leaves the health sector ill prepared to safeguard the most vulnerable. Could be infants, could be women, could be girls, could be elderly people, or could be just countries which are poor, least developed, low income, and so on. To fully harness the potential of climate services for health, transformational change in institutional development and integration across the health and climate sectors are needed. The word transformational is used also in transformational adaptation, but that means you completely change business as usual and start something brand new. Incremental increases are hard enough. Incremental changes are hard enough. Behavioral changes are hard even when incremental shift is needed. But transformational change requires a lot of reliable information that people are convinced, and we have to protect livelihoods when these things happen, because there are often interventions. People are asked to move, change their livelihoods, change the way they make a living, or lots of decisions are involved. They are expected to eat differently and so on. As you know from addictive behaviors and smoking and other things, or our addiction to energy and energy intensive lifestyles, transformational changes are actually very, very, very difficult. But there is also evidence that when people are faced with dire situations, they are capable of transformational changes. But then you need government policies, financing, incentives, and so on for individuals and firms to make transformational changes, in this case in the health sector. So we'll come back and read about this report, how it came about, and then we'll start looking at the challenges of climate services for health. Okay, I will leave this at 8.5 minutes, just to make sure that I got this correct, didn't screw up anything. Plus, I should mention I have a course on subseasonal to seasonal climate, subseasonal to seasonal predictions and applications, where we looked at early warnings for health, and I have also mentioned early warnings in many other contexts like adaptation, mitigation, climate introduction to climate science, climate solutions, and so on and so forth. All those things are on my channel. You can follow up. So come back and listen to how this report came about and what the challenges are in terms of producing climate services for the health sector, and what the state of the art was as of 2023. Okay, see you soon.